My patients represent the broad spectrum of humanity, and each one of their circumstances is unique. When someone comes to me for an abortion procedure, I provide them with counseling like I do for any medical procedure. So we talk about the risks, the benefits, the alternatives, we talk about safety. The most difficult scenarios that I have encountered are the ones in which my patients have trouble accessing basic reproductive health services. Currently I'm practicing in New York, but for a brief period I was working in Texas, and if a patient came to get an abortion, I wasn't able to provide that care that day. Instead, I would have to do an ultrasound, whether or not it was medically indicated. I had to describe the ultrasound to the patient, whether they wanted to hear it or not. I had to read a state-mandated script, which included some misinformation, such as abortion causes breast cancer. And then I had to send them away and had them return at least 24 hours later to receive their abortion. Now, none of these rules, none of these laws are founded in science, are evidence-based. They are all founded in ideology and do nothing to safeguard reproductive health. They only harm patients. Misinformation really just feeds and drives the stigma that I face, that my patients face, that this work faces. And I really wish that anti-abortion politicians would just recognize that I'm just trying to do my job. Many of our health centers have protesters outside, and our policy is to not engage with them. But I will say that I do respect that they are exercising their First Amendment right to free speech, but their posters and their yelling and their signs can be really disturbing and triggering for patients who are coming into the health center to receive care. I would like to see a lot of things changed about abortion laws in the United States. I would like for my patients to not have to navigate political obstacles to receive abortion care. I would like to see the removal of mandatory ultrasounds, of mandatory scripts, of mandatory waiting periods. I would like to see an end to the Hyde Amendment. The Hyde Amendment is a federal policy that prevents federal funds for being used to reimburse abortion services. And I would like for politicians to start recognizing abortion as health care, because the reality is that 7 out of 10 Americans do support abortion access, and that needs to be reflected by the government.